Today, we're going to be unlocking and unpacking your health after 50. And it changes for men and women. For women, we have to focus on premenopause and menopause. We've seen that as soon as women get to menopause, they lose the protection of estrogen and are susceptible to the same things men are: heart disease, strokes, you name it. Before then, they are protected. So we need to look at options like hormonal replacement therapy. We need to look at how to take care of that health. And at the same time, we're seeing women just plunge into, being fragile, losing bone density, losing muscle mass, etc. The usual suspects. With men, we have to watch for colon cancer, we have to watch for the prostate, and we have to follow the data, watch the marker. So we're going to go through the basics of what labs should you be having consistently to monitor your health. Including CAC scores, which is basically the heart, seeing the vessels around the heart, how much calcium they're accumulating. We need to look at specific hormone testing, the gut biome. We also need to look at some weight loss drugs that we can microdose. I've changed my opinion slightly on those. The highlights today will be really looking at what supplements we need, what's essential as we age, and what makes the biggest difference. So get ready. This is life-changing. Welcome to the Visitor Podcast. So I've got some notes because there's a lot to unpack. So let's start looking at the labs. Now, I like labs because we're in a data-driven health monitoring age. We need to identify risks before symptoms appear and tailor preventative strategies for optimal health and longevity. That's what we're all about. Okay, so specific blood testing, CAC scores, etc., will help us on this road. Now, your regular blood test might miss a whole bunch of stuff. Okay, so we're going to go through it. You're going to see tests that I would like you to have that won't come in your regular package. You're going to have to ask for these to do it specially. They're going to have to usually send it out to another lab to get it done, but it's worthwhile, and I'll show you why it's worthwhile. We're going to look at the CAC score and measurements. We're going to emphasize, the comprehensive lab testing helps us uncover hidden risks and can individualize the prevention strategies that we're going to use. And so it's critical to anything. And you need to be doing this on a bi-yearly or yearly basis so that you can monitor your health. If you have diet changes, exercise changes, if you are going through some health challenges, this is key. And what you're trying to do is optimize the levers that you can pull so that your lab tests get better. That's critical. So the key tests for the foundational health, we have the calcium artery score, CAC. Okay, the CAC measures calcification in coronary arteries to evaluate cardiovascular risk, even when other markers look normal. So this can show up even though your lab might look pretty good. So this test is especially crucial for those with familiar history of heart disease and metabolic issues, as detected the silent risk factors. Now, this is the thing. You could test all you want, and your tests come out. If you do regular tests, they can come out clean. A couple of months later, you get a heart attack. This happens all the time. Why? Not because they don't see it, because the tests aren't detailed enough. So this is the first one. The CAC is your first one to basically really show you, hey, how much calcification do I have? Now, calcification in arteries, coronary arteries, takes 20 years, 30 years to develop. Okay? Takes a long time to develop. So when we're testing, how come we don't see this when we're testing normally? Because we're not testing for it. We need to specifically look at this and say, hey, here we have a problem. Here we need to, we need to change our diet. We need to change our exercise regime. We need to change stuff here. So this is one of the issues that we're going to be looking at. We're going to be looking at blood glucose. And what I want you to do is get a fasted glucose, fasted insulin, check. So the HbA1c and fasting insulin cover fasting glucose, which gives a 3-month average of blood sugar level. So if you just do blood sugar and you don't do this test, you're going to have what they call mental now. You're going to have like, okay, today my sugar was good. No. What we want to see, and you might have been a good boy or a good girl like, this week or a couple of days before your test. No, what we want to see here with this test specifically is in the last weeks, how is your average? In the last months, and it goes up to 3 months, what is the average blood sugar level? So this gives us a more accurate view of what your levels are at, okay? So that's and I'll have a list of everything here. So this is the fasting glucose. So the next thing we're going to look at, which is off the chart sometimes, lipid panel with advanced markers that go beyond the basic LDL, HDL, your total cholesterol. Doesn't really tell you that much. I have a whole episode on this. There's LDLs and there's no bad cholesterol. First of all, the HDL and LDL just means in what type of protein package do they go through our bloodstream. And with the LDL, low density lipoproteins, what you get is a subset of LDL, which is totally small, really small, and can easily stick to the walls of the arteries if there is inflammation. So we're also going to check for inflammation. Okay, so how do we see this? We don't see this with a regular LDL, HDL, total cholesterol. We're going to have to do a test called ApoB. The ApoB is going to really count for us how many of these bad packages we have. And if that's high, then we need to really do something about it. So the ApoB is a much more accurate system for this. It measures the total number of atherogenic particles, giving a more accurate picture of heart disease risk. This is one test that you're going to have to order because you're not going to get it in your regular test. I also want us to do, of course, to test for inflammation. So CRP. I want to test, and this usually is covered: the liver, the kidneys, the renals, DHEA, etc. And that's usually covered in your regular test. I'm going over here what needs to be added to that. This age group, we need to really test for hormones. So we need to do a complete hormone panel, and that includes also a thyroid panel to see what our T3, T4 is doing, how it's converting, and if we're healthy there, because that could hamper us with weight loss and increase our weight gain. So we need to look at that. We need to look at our hormone panel, total testosterone, T3, testosterone, so the different markers, free testosterone, to see what that is. Testosterone is crucial for both men and women. It's indicative of muscle strength, bone density, libido, mood. It can wreak havoc on both women and men. So we really need to test this. We need to see that our levels are good. It can contribute to fatigue and metabolic slowdowns, which you don't want. So it's a critical test that needs to be done. Estrogen and progesterone for women address how these hormones, they protect against bone loss, heart disease, support brain health, mood, energy. Replacement. So this is a call to do hormone replacement therapy. It can mitigate menopausal symptoms and protect health when managed carefully. We looked at the thyroid hormones, the THAs, free T3, free T4. This regulates metabolism, energy levels, and cognitive function. And all these numbers will start declining with age. So we need to test them, make sure they're up to par. DHA, EA, and cortisol. The adrenal health is important. Adrenals are right above the kidneys, and they, produce DHEA for energy and immune support. And cortisol can be a marker of stress level. So we look at cortisol to see, okay, what's your stress? Is it, is it throwing your hormones out of balance? Hormone replacement therapy, in this case, I think huge benefits. And for women specifically, they need to be looking at this in their premenopausal stage because that's when they have the biggest impact. And I highly recommend it. I highly recommend it because it makes your life different. It protects you. And we're seeing just so much damage to the body and decline of the body when women are not on hormone replacement therapy. So it's and see your doctor, see a specialist that knows how to do hormone replacement therapy, and get on it. We need to cover some of the vitamins. So you're also going to get tested for vitamin D, omega-3, fatty acids. These need to be at good levels in the system because that could hamper everything. Magnesium. So when we look at individuals over 50 and we're looking at it backed by research, these essential support needed for aging body: vitamin D. Vitamin D supports bone health, immune function, hormonal balance. You need to be taking about 3,000 to 4,000 of vitamin D with K2 to improve calcium regulation and potentially lowering cardiovascular risk. Together with that, and I had a whole episode on that, you get magnesium. 300 enzymatic reactions, including muscle function, relaxation, and blood pressure regulation. Magnesium can prevent kidney stones formation by binding the oxalates in the gut, reducing the absorption. Omega-3 fatty acids is another one that needs to be taken. And this can be, you can do plant-based, you can do microalgae, you don't have to do fish. So omega-3, the main function is to reduce inflammation, improve heart health, and support brain function, emphasizing the importance of EPA, DHA, that form the potency and how they balance pro-inflammatory effects of omega-6s, commonly high in the diet. The dosage recommendations here, you want to keep it around 1,000 to 3,000 milligrams. Creatine monohydrate. Absolutely, everyone should be on this for brain health, for muscle protein synthesis, and for the function of the body. It is key for cognitive health, reducing fatigue, improving mitochondrial function. Mitochondria, of course, is the motor of our cells, which in aging populations starts declining in efficiency. So, it supports ATP production, both mental and physical energy levels. It's widely researched, and the recommended dosage 3 to 5 milligrams daily. I would lean more on the 5 milligrams daily. B vitamins with a focus on B12 and folate. The roles of B vitamins: really energy metabolism, nerve health, cognitive function. Deficiencies in these are common in aging population, especially individuals taking medications. So you need to look at testing. I think the couple of other mentions, I would do CoQ10 for mitochondrial support and antioxidant protection, especially if you're on statins. Integrate this into your daily routine. I'm going to go into a part that might trigger a couple of people, and that is the use of semaglutide or Wegovy and trizepatide, better known as Mounjaro. And there's also a new one that has actually three agonists. So the first one, Wegovy, is a GLP-1 agonist. And, it's shown to drop your weight and control glucose uptake. Now, the next level is Mounjaro, which is a GLP-1 and GIP antagonist, which basically works more efficiently on your body, makes you lose more weight. And I'm talking specifically weight loss, but it's actually diabetic management. So if you're diabetic, these are great drugs to have on your side. If you're not, if you're looking at mostly for weight loss, they're extremely helpful. They work. Now there's some side effects, muscle loss, but we'll talk about how to mitigate that. And there's a new one coming out that are testing. It's actually the third level, which is also glucagon agonist, which then really gets three processes going in controlling blood sugar, controlling insulin, and weight. So these are amazing drugs, and what we've seen is that they could be helpful in controlling your weight. Now I know there's a lot of people out there that have challenges with their weight. It's a big one. Even if it's a low weight, you've always been overweight, you can't drop it. It's just frustrating. And I totally understand. So we're looking at, enhancing satiety, meaning you feel less hungry, regulate blood sugar, reduce cravings. A dual effect on GLP-1 and GIP receptors allows it to support sustained weight loss and improve metabolic health. Now, what we're going to do here is go a little off chart. And what I've seen and what we're looking at is a different use of it, and that is microdosing, meaning lower than the lowest dose they give for weight loss. Really microdosing, and a physician needs to work with you that knows how to work with this as a potential approach, where a lower consistent dose may help manage your weight without some of the side effects seen at full doses. Microdosing could allow those over 50 to maintain better control over their weight while reducing the risk of serious side effects. Now, what we're looking at here is for you to lose 1 to 2 pounds a week, not more. So when you're on the normal dose, you will lose much more than that. We don't want that, because if you're losing much more than that, you're going to be losing a lot of muscle mass, and it's going to be almost impossible to get off the drug. You're going to have to use it the rest of your life, because if you're on that heavy dose, once you get off it, everything comes back, the cravings come back, and you go and you eat and you gain your weight back. We don't want that. It's a very expensive drug. Well, but what we've seen is that if we microdose, and we might need to have a compounding lab do this, where they can make it in smaller doses, and you do a consistent smaller dose, and it's just a insulin injection in the fat. That's how this is given. Then we're seeing that it helps you lose the weight, so 1 to 2 pounds maximum a week, consistently. When you get to your right weight, drop the dosage or stop, monitoring it. And so you're still gonna have to do the work. You're still gonna have to do resistance training minimum 3 times a week. You're gonna have to do your cardio, zone 2, mostly, with maybe once a week you do hits. This is the basis, of course. Your nutrition needs to be on point. You need to change your nutrition, because you don't want to be dependent on this drug. You want to actually transition to be able to do it yourself. But this is going to give you help to get to a place where you feel like you have a win. Sometimes we need a win, and a lot of people dealing with obesity haven't had a win ever. You know, they've had bounce diets where they went down and then doubled up and came back up higher than before. So we need a win. I understand that. So this can give you that win. Work with a physician. It's a way to go. We're seeing that now, but it's really microdosing. It's not using the dosages that we do with, with the regular weight loss group. So because at that dosage, you're gonna have too much muscle loss at this age. You're gonna have a problem getting off it, etc., etc., etc. Cravings are gonna come back and wreak havoc. So we tread the needle on this one, okay? And I think this is these are the big things. Now we'll go into real specific stuff. We can go much deeper into real specific stuff, but I wanted to cover the basics. And with these basics go resistance training, zone 2 cardio, as we talked about before. Your nutrition needs to be on par. Whatever diet you're using needs to be on par. Your proteins needs to be high. Your first meal needs to have 2.5 grams of leucine, amino acid, so protein, to start the anabolic cycle with your first meal, second, third meal. So you really need to up your protein. Total protein in a day needs to be 1.2 to around 2 grams per kilogram of ideal body weight. And really, we need to go more towards the 2 as we age. So it needs to be high. Okay, protein needs to be high. Carbs, lower, but you need fiber. Fiber is critical. So make sure you have fiber, fruits, vegetables with that. And fiber is also critical for your gut biome. Now, if you've been on medication or you are on medication, then you need to take care of your gut biome by, taking in pre and probiotics. Seed is a very good company for this. Then upping your fermented foods that you eat weekly, and then introducing fiber also into that mix. And that's a whole episode in its own, but just a quick review. So these are kind of the things that we need to be monitoring. These are the big, the big areas, the big bang for the bucks. So in this episode, I've included the labs that I think you should be taking and looking at, and your physician should be looking at with you. And if there's more specific stuff that you find, then you can go in deeper. But this is the basic to really monitor your health. Make sure that you're protecting yourselves against, all the chronic diseases that come with age, inflammation, arthritis, you name it. Also, ApoE is one that you need to be doing, and that's just to see if you have a genetic predisposition for Alzheimer's disease. Lipoprotein little a is also you should be doing. That's other genetic test to see if you are susceptible for having high LDL in an ApoB in the blood. And if that is so, then you need to really suppress it, and you need to check the rest of your family. That test you do once and that's it, because it's genetic. You either have it or you don't. So is the ApoE. So these are 2 tests that are genetic tests that you need to be doing once to see. And if there's a predisposition there, then you need to take action. And that was it. So I hope this was informative. I hope this gives you more direction on what testing you need to be doing biannually or annually as we go, and to really look at how you can improve your results. One of the things that I also suggest is if you have issues with glucose or sensitivity, insulin sensitivity, then you need to be wearing a 24/7 glucose monitor and see what foods affect you and how they affect you, so that you can really hone in to customize your diet, customize what you eat, what you intake, what you drink. And that could do it. And one of these companies that's really good at it is Levels. I'm not sponsored by them, but they are good at what they do. So that's another option you need to look at if you have an issue there, if you have a concern there. Again, thank you. And the journey continues.